Welcome to Medical Help. Today I'm just going to explain about anorexia nervosa. And before starting the video, I would like to say who are new in this channel, please subscribe my channel and share this channel as much as possible. So let's talk about anorexia nervosa. Anorexia nervosa is a condition where the patient or the person refuses to maintain body weight over a minimally normal weight for race and height. Example, weight loss leading to maintenance of body weight less than 85% of that expected, or failure to make expected weight gain during a period of growth leading to body weight less than 85% of that expected. Intense fear of gaining weight or becoming fat even though underweight. Disturbance in the way in which one's body weight or shape is experienced. Undue influence of body weight or shape on self-evaluation or denial of seriousness of the current low body weight. In post-menarcheal females, amenorrhea, that is the absence of at least 3 consecutive menstrual cycles. A woman is considered to have amenorrhea if her periods occur only following hormone. Example, estrogen and administration. The types of anorexia nervosa. There are two types, restricting type and binge eating or purging type. Restricting type, during the current episode of anorexia nervosa, the patient has not regularly engaged in binge eating or purging behavior, that is self-induced vomiting or the misuse of laxative, diuretics or enemas. Another type, binge eating or purging type. During the current episode of anorexia nervosa, the patient has regularly engaged in binge eating or purging behavior, that is self-induced vomiting or the misuse of laxatives, diuretics or enemas. The term anorexia nervosa doesn't mean that appetite absence. The individual will actively counter feelings of hunger with disordered thinking, leading to self-imposed starvation. The threshold for anorectic weight loss is the situation then the body mass index is less than or equal to 17.5 kg per meter. Calculated as weight in kilograms and height in the meters, that is the formula of BMI. So what is the etiology of this condition? The etiology is bimodal, biological and cultural. Evidence for socio-cultural factor etiology. The incidence and prevalence of eating disorders have increased greatly in the latter half of the 20th century in industrialized societies. Immigrants from cultures in which anorexia nervosa is rare are more likely to develop the illness as they assimilate the ideas of a thin body appearance. The incidence of anorexia nervosa are the highest among patients with middle and highest social classes. You can see standards of beauty of 20th century. Evidence for biological factors. Concordance rates for monozygotic twins with anorexia nervosa are higher than those for dizygotic twins. There is an increased risk for anorexia nervosa and for mood disorder among first-degree biological relatives. The disturbances in central nervous system, norepinephrine and serotonin dysregulation, decreased brain-derived neurotrophic factor BDNF. Epidemiology. More than 90% of affected individuals are female. Lifetime prevalence rate for anorexia nervosa are approximately 1 in 100 to 200 individuals. Prevalent first peak occurs in early adolescence, age 12 to 15 years, second in age 17 to 21 years. The mean age at onset is approximately 17 years. Clinical findings. We can see in this condition weight loss, BMI is less than 18, accomplished by a reduction in total food intake leading to an extremely restricted diet. The body image distortion with disturbed self-perceptions as fat, obese is globally overweight, or as if certain body parts are too big, the abdomen, buttocks, or thigh. Denial and concealing behavior, complaints of distastes for food or epigastric discomfort, food related obsessions. Physical findings: emaciation, significant hypotension, especially orthostatic, bradycardia, hypothermia, skin dryness, lanugo, or the presence of downy body hair on trunks or extremities. Russell sign or scars are calluses on the back of the hand. Peripheral edema, especially ankle edema, amenorrhea, delayed menarche in prepubertal females, salivary gland hypertrophy, particularly of the parotid gland, dental enamel erosion. These are seen in this condition. And differential diagnosis: general medical conditions can cause serious weight loss and major depressive disorders. Exclusion certain criteria: there is no fear of gaining weight. Treatment for bulimia nervosa: a multidisciplinary approach. Beside psychiatrists, the team has to include therapist, cardiologist, diet consultant, psychotherapist, etc. The weight restoration should be a central goal for the treatment. The patient must be engaged in individual and family therapy. Pharmacologic agents such as antidepressant, neuroleptics, these are, and lithium may be helpful.